Give the transfer the difficult one, see how fast she quits. Welcome back to Steady Badge's Stories. I'm glad you're here tonight. Whether you're driving back from a long shift, sitting somewhere quiet with something warm to drink, or just needing a story that reminds you what real courage actually looks like. If this one stays with you, hit the like button, subscribe so you don't miss what's coming next, and leave a comment telling me where you're listening from. I want to know how far these stories reach. Now let me tell you about the day they handed the nurse. Nobody believed in the one patient nobody else would touch, and what she found in that room changed everything. The handover note was taped to the outside of room 7's door, and it said 3 words in block lettering: "Do not bother." Below that, in the same careful hand, was a list: non-verbal, non-compliant, combative with staff, refused all assessments for 48 hours. 2 orderlies had left that room in the same afternoon. A resident had filed an incident report. The outgoing charge nurse had simply stopped going in. Celeste Harding read the note. Then she pulled it off the door and folded it into her pocket. She had been working at St. Edmund's General in Kingston, Ontario for 19 days. 19 days of being called the transfer, of receiving the charts no one else wanted, of hearing Dr. Everett Morse refer to her as the new girl on 4 North in the hallway, as though she were a piece of furniture that had been left in the wrong place. She was 37 years old. She wore the same blue scrubs every morning, kept her hair in the same short braid, and said very little, because she had learned long before this hospital that invisible was often safer than visible. Donna Spares had been charge nurse on 4 North for 11 years. She knew how a ward ran, and she knew how to make a person feel the weight of a room without raising her voice. When she handed Celeste the chart that morning, 3 nurses were watching from the station. Kyle Berard, the second-year resident, had his phone out. He wasn't recording, not yet. Staff Sergeant Warren Abara, Donna said. 46, CAF veteran, Nigerian-born, Canadian citizen. Combat-related TBI, significant trauma history, intermittent aphasia under stress. Admitted 4 days ago post-collapse during a physiotherapy appointment. He hasn't allowed anyone to complete a full assessment. Vitals are approximate at best. A pause. He's yours. One of the nurses near the printer smiled into her coffee. Celeste took the chart without a word. Kyle said from across the station, "You might want to knock loud. He doesn't seem to like services." He said it the way people say things they want other people to hear. Celeste walked to room 7. The room smelled like antiseptic and old fear. That was the only way to describe it. Old fear. The kind that settles into the corners of a place where someone has been alone and in pain for too long. Staff Sergeant Warren Abara sat upright in the bed with his back against the headboard, not the pillow. His arms were at his sides. His eyes moved to the door the moment she came through it, tracked her hands first, then her face, then the door behind her. He was a large man, broad through the shoulders, graying at the temples with a scar that ran from his jaw toward his left ear. His expression was not anger, it was vigilance, the kind that didn't switch off anymore. A whiteboard near the sink read, "Patient nonverbal use communication." The marker was on the floor. Someone had dropped it there and not come back. Celeste picked up the marker. She set it on his tray table within his reach. Then she pulled up the chair, not beside the bed where it left him with his back to the door, but across from it, so he could see both her and the exit at the same time. She raised both hands, palms open. Then she wrote on the whiteboard herself. "My name is Celeste. I'm your nurse today. I won't touch you without asking first." Warren read it. He didn't move. She wrote again. "You can tell me to leave. I'll go. But I'm going to sit here for a few minutes either way, if that's all right with you." He stared at her for a long moment. Then he reached for the marker she had left on the tray table. He wrote one word: "Why?" No question mark, a statement. Celeste considered it honestly before she answered. "Because the last 3 people who came in here didn't stay long enough to understand what you were actually saying. I'd like to try." Something shifted in his face. Not trust, it was too early for trust, but the vigilance recalibrated very slightly toward something other than immediate threat. He wrote, "Everyone thinks I am confused." "I think you're exhausted and in pain," Celeste said aloud, "and no one's been listening." She said it plainly, not softly, not the way people speak to someone they've already decided can't understand them. Like one adult to another, across a room where the marker was finally where he could reach it. Warren looked at her for a long moment, then he pointed to his right calf. The swelling was visible even through the blanket. When Celeste asked permission and pressed carefully, Warren winced. The skin was warm. His right ankle was swollen in a way the chart had not noted, listed 3 days ago as dependent edema from inactivity, and not mentioned again. His heart rate on the monitor read 112. His temperature when she took it after asking was 38.4 Celsius. His oxygen saturation read 94, flagged in the chart as stable, but 2 days prior it had been 97. She listened to his lungs after he nodded permission. Both sides present, but his left lower field was working harder than it should. He wrote while she charted his vitals. Pain in chest, not my heart, different, gets worse when I breathe deep. Celeste kept her face neutral. She did not want to alarm him. She also could not afford to waste time. Warren, how long has your leg been like that? He wrote, 2 days. I tried to tell them. They wrote anxious in the chart. She had read the chart. That word appeared 6 times in 4 days. She stepped out to the hallway. Dr. Everett Morse was at the nursing station with a tablet in one hand and a coffee in the other. He was polished in the way that men who had never been seriously doubted often were. Pressed coat, practiced confidence, a way of looking at junior staff that conveyed they were furniture. He hadn't decided whether to rearrange. Dr. Morse, room 7 Abara. I'm concerned we're looking at a developing PE. Right calf swelling, warmth, pleuritic chest pain, oxygen trending from 97 to 94 over the last 48 hours, tachycardia at 112, low-grade fever. Morse did not look up from his tablet. He's a trauma patient with anxiety and documented compliance issues. The tachycardia is consistent with his history. His right calf is warm and swollen on one side only. He's describing sharp chest pain on inspiration. He's describing. Now Morse looked at her. The word landed with a particular weight, the kind meant to remind her what the chart said about Warren Abara's capacity to communicate. He's writing it out clearly. He communicates when someone gives him the means to do it. Kyle Berard had drifted close enough to hear. Donna appeared at the edge of the station. Morse said, I'll note the concern in the chart, continue monitoring. He needs a D-dimer and Doppler ultrasound today. The pause that followed was not consideration. It was a specific kind of silence that men like Morse used when they wanted a junior staff member to feel the distance between their positions in a room. I determine what he needs, Ms. Harding. Your role is monitoring, do that. He walked away. Celeste stood at the desk for 3 seconds. Then she went back to room 7. Warren had written on the whiteboard while she was gone. Did they listen? She wrote, not yet, I'm not done. The corner of his mouth moved, not quite a smile, something closer to recognition. She sat across from him again. His rate had climbed to 118. His breathing was careful in the way people breathe when a deeper breath hurts. He wrote, I was a medic before the injury. I know what this feels like. Then after a pause, he kept writing. I filed a formal complaint about what happened to my unit. Medical reports were altered. Men were kept on deployment rotations when their injuries required discharge. 3 of them are dead. I have the documentation. They know I have it. Celeste read it twice. The documents are in my prayer book, in my personal bag. My bag was supposed to be here when I was admitted. She looked at the bedside table, a phone charger, a water cup, no bag. They told me it was taken for safekeeping. That was 3 days ago. Every time I ask, they say it's in storage. She wrote carefully. Who knows about the complaint? He looked at the board, then at her, his hand moved slowly. The tall doctor. He has a consulting contract with the CAF. I found his name on the audit trail from the altered records. The room was quiet around that sentence for a long moment. His oxygen saturation hit 91 at 2:47 in the afternoon. Celeste was at his bedside when the monitor alarmed. She had not left the room for more than 10 minutes at a stretch since their first conversation. She had documented everything, every vital, every word Warren had written, the timeline of the missing bag, the pattern of decline that did not match anxiety and never had. She hit the call bell. Then she activated the rapid response directly from the room panel, because she already knew what was coming next. The announcement cracked through the unit. Rapid response, 4 North, room 7. Rapid response, 4 North, room 7. Morse arrived first, which told her he had been somewhere close. His expression when he came through the door was not worry. It was something harder than that. Cancel the rapid response, I'm here. His saturation is 91 and falling. He's anxious. He is not anxious. Celeste's voice did not rise, it did not need to. He is hypoxic. His right calf is warm and swollen. He has unilateral pleuritic chest pain. He has been declining for 48 hours. That is a textbook presentation of pulmonary embolism, and you have been charting it as non-compliance. The rapid response team came through the door before Morse could form an answer. Suki Tam from respirology arrived 40 seconds behind them. Morse said, I was preparing to order imaging. Suki looked at the monitor. What's his trend? Celeste answered, 97 to 94 over 48 hours, dropped to 91 in the last 60 minutes. Tachycardia throughout, temperature 38.4, right calf swelling and warmth, sharp inspiratory chest pain, all reported through written communication. Suki turned to the team. D-dimer now, portable echo, high-flow oxygen. She glanced at Celeste, who caught the calf. He pointed it out to me. I asked permission and examined it. Suki looked at Morse. Morse looked at the wall. The D-dimer came back elevated. The portable chest CT ordered over Morse's documented objection, a fact that went into the chart, confirmed bilateral pulmonary emboli. The right side was the larger. Warren was moved to a monitored bed within the hour. Anticoagulation was started. Within 40 minutes, his color began to return. He wrote from the new bed, oxygen mask pulled slightly aside, you stayed. Celeste moved the mask back into place. That's the job. He pulled it aside again, more deliberately. No, he wrote. That is not what the others thought the job was. She didn't answer that. She checked his rate, 96, improving, and wrote it in the chart. Warren's hand moved again, 4 words. You were listening, always. She looked up from the chart. He was watching her with an expression she recognized. Not gratitude. Gratitude was too simple a word for it. It was the look of a person who had been reaching out through a wall for days and had finally felt a hand come back. She felt the old weight settle against her sternum. She had learned to carry it quietly, and she carried it still. The bag was found 3 hours later. Suki had mentioned the missing personal property to the ward clerk. Routine documentation for a monitored transfer, she said. The clerk checked the storage log. The bag had been signed out by a hospital administrator named Gerald Keene at 7:14 a.m. on Warren's second day of admission. Celeste wrote that time down. She also wrote down that Gerald Keene's office was on the same administrative floor as the KF medical liaison desk, and that the public procurement record she found on her phone during her break listed Dr. Everett Morse as a named clinical consultant on the CAF's Forward Health Services contract, renewed annually, most recently 8 weeks prior. She did not say any of that yet. Facts were cleaner than accusations, and she had learned the difference between them in places where getting it wrong cost more than a career. At 4:30 p.m., a man in civilian clothes appeared at the nursing station. He carried a clipboard and wore a facilities badge that sat slightly wrong on his jacket. The lanyard too new, the badge itself angled inward and away from easy reading. Celeste was at the station completing her notes. She looked at his shoes, soft soles unscuffed, the kind of shoes that had not actually spent a day walking these floors. She stood. Can I help you? Just a property verification, routine for patient transfers. I'll need to see your employee ID and the work order, please. He smiled the way people smile when they expect automatic compliance. It's a quick thing. I'm sure it is, ID and work order. He didn't have either. Celeste said at the same volume as before, Donna, could you call security to the station? We have someone here requesting access to a patient's personal effects without verified credentials. Donna Spares looked up from across the hall. Something in the way Celeste said it made her reach for the phone without a single question. The man was gone before security arrived. His badge number matched no facilities employee in the system. Surveillance footage later placed him coming off the elevator from the administrative floor, Gerald Keene's floor. Major Alec Fournier arrived at 6 o'clock. He was from the office of the CAF Surgeon General, a JAG liaison, following the trail of a formal complaint filed 7 weeks earlier by Staff Sergeant Warren Abara regarding the falsification of medical records in CAF's Forward Health Services unit. The complaint had been acknowledged. Then it had gone quiet in a way that complaints sometimes go quiet when the people responsible for processing them have a financial interest in silence. Major Fournier had driven 3 hours from Ottawa after Warren's sister called to say her brother had been admitted to hospital, that his condition had deteriorated in ways she didn't understand, and that the personal belongings he had specifically asked her to make sure stayed with him had disappeared. He came to the nursing station and asked for the charge nurse. Donna started to answer, then she stopped and looked at Celeste. Celeste said, Major Fournier, I'm Celeste Harding. RN, I can brief you on Sergeant Abara's current medical status, and there are some other matters from today I think you need to hear. Fournier looked at her steadily. All right. She laid it out in order, the same way she had been trained to brief. Chronological, factual, nothing editorialized. Warren's clinical presentation and the ignored escalations. The delayed diagnosis and what the delay could have cost. The missing bag and Gerald Keene's sign-out. The unverified individual and his soft, clean shoes. The CAF contract with Morse's name attached. She had written everything down. She handed Fournier the notes. He read without expression. Then he looked at her the way people look at someone when they're trying to locate a piece of information that doesn't quite fit the frame they expected. Where did you work before St. Edmund's? Vancouver General. And before that? The hallway was quiet. Donna had stilled near the medication room. Kyle Berard stood at the far end of the station, not quite looking at them. I was medically retired, Celeste said. From? She held his gaze. That's a longer conversation. Fournier was quiet for a moment. Then, low enough that only she could hear, the original complaint was buried through this hospital's administrative chain. Someone with clinical standing signed a secondary assessment saying Abara's account was unreliable due to cognitive impairment from his TBI. That signatory appears to be Morse. Yes, Celeste said. And you suspected that. I confirmed it when I checked the procurement records during my break. The contract renewal was processed 8 weeks ago, 2 weeks after Warren's complaint was filed. Fournier looked at the notes again, then directly at her. What was your call sign? She said nothing. He nodded once, as if she had answered. Dr. Morse was called to the administration office at 7 that evening. Gerald Keene was escorted from the building by 2 security officers and a Kingston Police Service constable who had arrived without announcement. Warren's prayer book was recovered from a locked cabinet in Keene's office, the documents inside it undisturbed. 3 witness statements from soldiers who had served alongside Warren, and an audit trail showing medical records altered to reflect mild strain injuries in place of documented spinal fractures, traumatic brain injuries charted as stress responses. Warren held the prayer book when they brought it to him. He did not open it immediately. He held it in both hands, and Celeste watched something in his face release that had been held since long before this hospital, long before this room. He wrote after a while in slow, careful letters. 3 men from my unit, Darbaugh, Mensah, Osei. They kept them deployed when their injuries required discharge. Darbaugh had a spinal fracture that was filed as muscular strain. He died in a training exercise 8 months later. Mensah had a traumatic brain injury called a stress response. He hasn't spoken since 2019. Osei got out. He found the original records. He gave them to me to bring home. Celeste read it. She didn't offer condolences. Warren did not need her condolences. He needed someone to hold the weight of the record alongside him. Major Fournier has the documents now, she said. Federal process from here. Warren nodded. He wrote one more line. 4 days. No one could understand what I was trying to say. You walked in and you put the pen where I could reach it. She looked at the tray table, at the marker she had set down in the first 5 minutes. You were already talking, she said. I just stopped walking past. The next morning, Donna Spares came to find Celeste in the break room. She stood in the doorway for a moment before she crossed it. She looked smaller than she had the day before, not physically, but in the way a person's presence contracts when certainty has been taken from it. I thought it would be harmless, she said, giving you that room. Celeste looked at her. You thought it would be humiliating. Donna didn't look away from that. It surprised Celeste that she didn't. Yes, Donna said. I thought you'd come back out in 10 minutes like everyone else who tried. She sat down, uninvited but without presumption. Why didn't you? Because he wasn't difficult, Celeste said. He was precise. He knew exactly what he was trying to tell us. There's a difference. Donna turned her coffee cup in both hands. She said, after a moment, I want to learn the written communication protocol properly. Not just a whiteboard and assumptions. There's a resource through the Canadian Hearing Society, Celeste said. I'll send you the link. Thank you. A pause, I'm sorry. Celeste said, start with the protocol, that's what matters now. Donna nodded. She picked up her coffee and left. Celeste understood that forgiveness had its own long road, and she was not going to rush it or cheapen it. But she had watched Donna reach for the phone in that hallway yesterday without needing to know why, just because Celeste's tone told her it mattered. That was a door. Doors were worth something. Warren was discharged 11 days later. He walked out of 4 North on his own, his prayer book tucked under his arm and his sister beside him, and he stopped at the nursing station on the way to the elevator. Kyle Baird was there. He looked at the floor. Donna was there. She looked at Warren directly, which was not easy, and she paid the cost of it. Warren didn't speak. In low-stress moments, his aphasia was mild, but he chose to write. He pulled a small notepad from his jacket pocket, his own, not the ward's, and wrote something and held it up so the whole station could read it. The man you couldn't understand was listening the whole time. So was the nurse you chose to embarrass. What you decided to hear said everything about you. What she decided to do said everything about her. He tucked the notepad away. He looked at Celeste and made a small gesture with his right hand, not military, not formal, the kind of gesture that simply means, I see you. She nodded once. He walked to the elevator with his sister, and when the doors closed, the nursing station was very quiet. Kyle said, to no one in particular, I should have said something, before it got that far. Yes, Donna said, so should I. She said it without drama, the way a person says something they intend to remember. Major Fournier's investigation led to a federal review of KF medical records across 3 deployment cycles. Dr. Morse resigned from his consulting contract before the interim findings were published. The documents from Warren Abara's prayer book, witness statements, and an audit trail showing altered timestamps formed the foundation of the case against him. Gerald Keane was charged. St. Edmund's General revised its patient communication policy. The new protocol required a documented first attempt at alternative communication, written, gestural, interpreted, before any notation of non-compliant could be entered in a patient chart. On paper, it was a small thing. In the first month it was in effect, it changed the approach to 23 patients on 4 North alone. Celeste wrote the training module. She didn't put her name on it. She didn't need to. Fournier stopped by the ward 3 weeks later, on his way back to Ottawa. He found Celeste in the supply room counting gauze packs. The sealed records request was processed, he said. Your service file. She kept counting. I know. You were listed as killed in a training accident, 2017. I know that too. JTF2, he said it quietly, the way you say a thing you've already confirmed, call sign Crow. She turned around. The government will want to formally correct your record, he said. Remove the false notation. I know. Do you want that? She looked at the shelves, at the gauze packs and the IV lines and the blood pressure cuffs, and the 100 small necessary things that kept people alive in ordinary rooms, on ordinary days, when the right person paid enough attention. I want, she said carefully, for the paperwork not to interfere with my Tuesday morning shift. Fournier almost smiled. I'll see what I can arrange. He left. She finished the inventory. A few days later, a handwritten note appeared in her locker. No name on the outside, neat block printing she didn't recognize. You gave a veteran his voice back when no one else stopped long enough to notice he still had one. From someone who needed the same thing once. Thank you. She read it twice. She folded it and put it in her pocket. She had come to St. Edmund's General to disappear into the work, to be useful without being noticed, to be present in the rooms where people were afraid and in pain and no one else knew what to do, to pay a debt she had decided she owed. She understood now that she had been wrong about one part of it. Not about the debt, not about being useful. But silence was not the same as peace. Sometimes silence was what filled a room after too many people had decided the person inside it was not worth the effort of understanding. Sometimes the person labeled impossible was simply waiting for someone to hand them the pen. The people who thought they were sending her somewhere to fail had sent her exactly where she was supposed to be. She clipped her badge straight, pulled her scrubs smooth, and went back to the ward.